Seeing a physical therapist is something that people in this community do quite frequently. Usually they're referred to the physical therapist. A physical therapist generally is not a primary provider. You know, they typically don't make the diagnosis. You would come to the physician, either your primary care physician or your orthopedic physician, and we're probably better at making a orthopedic or musculoskeletal diagnosis, I think, than a therapist. And then we would refer that individual to a physical therapist if we felt that they needed it. And we do that quite frequently. You know, most people that come in with knee pain, it's not a surgical problem. Most people don't need anything more than an exam and x-rays. Most people don't need advanced imaging like an MRI. But most people do end up with a physical therapist. And it could be very helpful because the physical therapists are very good, not only at looking, for example, at the dynamics of the gait, you know, and they can kind of connect all the body parts and determine what the individual has to work on after we send them there with a diagnosis. And many times a physical therapist will get the individual on a home program. So going to physical therapy doesn't mean that it's going to affect your life and you're going to have to go 2 to 3 times a week for 6 weeks necessarily. Some conditions need that, but most people will go for 2 or 3 visits, they'll get on a home program, and then hopefully they're compliant and they can do most of it on their own.